Have you ever noticed how hearing the word outbreak can make your chest feel tight before you even know what it means for you? One of my patients once shared that memories from earlier epidemics came rushing back the moment she heard that word, even though nothing around her had changed. I want you to imagine this for a moment, looking back at history not as a warning siren, but as a quiet teacher offering guidance. My name is Dr. Evelyn Carter, and I have spent many years caring for older adults and their families. Today, I want to talk with you about Nipah virus outbreaks and the warnings we have learned from past epidemics. Not to suggest that danger is approaching, but to help you understand why doctors look to history when they want to protect people, especially seniors, with calm preparation rather than fear. Many older adults carry memories of public health crises that were confusing and overwhelming. Words like epidemic can awaken those feelings quickly. From my caregiving experience, I know that these memories can disturb emotional balance, sleep, and even daily routines. This is why it matters how we talk about history. When lessons from the past are explained gently, they help reduce confusion and restore a sense of steadiness. Doctors study past outbreaks because patterns teach us what early signs were missed, what responses helped later, and how calm communication made a difference. With Nipah virus outbreaks, history shows us how delayed recognition, gaps in information, and the unique needs of aging immune systems shaped outcomes. It also shows us something hopeful. When communities responded thoughtfully and people stayed informed without panic, care improved. This video is not about reliving fear. It is about understanding how lessons from earlier epidemics guide better decisions today. In the next part, we will begin by looking at why outbreak history matters and how it helps doctors protect emotional safety as much as physical health. If this conversation feels grounding, I invite you to like this video, share it with someone you care about, and subscribe to Senior Health Daily. This channel exists to offer calm guidance, steady reassurance, and a place to return when health questions arise. Take a gentle breath with me. You are not alone, and learning together is one of the strongest forms of care. Why outbreak history matters. When doctors look back at outbreaks, it is not to relive fear or predict trouble. It is to understand patterns that help people stay steady and protected. History gives us perspective, and perspective is especially important for older adults who value clarity, routine, and peace of mind. I have learned over many years of caregiving that when people understand why doctors study the past, worry softens and trust grows. Outbreak history matters because illness rarely appears without leaving traces. The body speaks quietly at first, and communities respond in stages. In earlier epidemics, we see how small signs were overlooked, how information traveled unevenly, and how fear sometimes spread faster than facts. We also see moments of calm leadership, thoughtful communication, and patient care that changed outcomes. Those moments are not accidents, they are lessons. Patterns repeat when lessons are ignored. When early signs are dismissed as ordinary, care is delayed. When messages are rushed or unclear, anxiety rises and routines fracture. When older adults are not considered carefully, their unique needs can be missed. History shows us this again and again, not as blame, but as guidance. Understanding these patterns allows doctors to respond earlier and communicate more gently. From a clinical standpoint, history helps us recognize timing. Many outbreaks escalated not because the illness was immediately severe, but because early responses were fragmented. When caregivers were supported and information was consistent, people felt safer and sought help sooner. That steadiness matters. Anxiety affects sleep, memory, blood pressure, and balance. Calm awareness protects the nervous system and allows better decisions. For seniors and those living with memory changes, history offers reassurance. It shows that confusion during outbreaks was often caused by noise, not danger. When messages were simplified and routines protected, people did better. Families learned to observe patterns over days rather than react to single moments. Doctors learned to listen more closely to caregivers. These lessons shape how care is delivered today. I often tell my patients that history is like a map. It does not tell you where you must go. It shows where others have been and what they encountered along the way. With that map, you can choose a calmer route. You can avoid unnecessary detours. You can move with confidence rather than haste. Understanding why outbreak history matters helps place today's information in context. It reminds us that learning is an act of respect for the body and the mind. It steadies the heart and quiets the urge to imagine worst outcomes. When history is held gently, it becomes a source of wisdom, not worry. That wisdom supports dignity and allows seniors to feel informed, prepared, and emotionally safe. How Nipah virus outbreaks began. When we look back at how Nipah virus outbreaks began, what stands out most is not panic, but uncertainty. The earliest moments were often quiet. People felt unwell in ways that seemed familiar. A fever that felt like a seasonal illness, fatigue that could be explained by work or age, a cough that did not seem urgent. Because these signs were ordinary, the connection between them was not immediately clear. Transmission was also confusing at first. In past outbreaks, people did not understand how the virus moved from one person to another or from animals to humans. Daily routines continued. Families cared for one another as they always had. Health workers treated symptoms they saw every day. Without clear patterns, there was little reason to assume something unusual was unfolding. This is how many outbreaks begin, not with alarm, but with normal life continuing. Early responses were delayed because information arrived in pieces. Reports came from different places and did not always match. Some patients worsened quickly, while others recovered. This inconsistency made it difficult to see a single cause. Doctors are trained to look for the most likely explanation first, and in the beginning, common illnesses made more sense than a rare virus. That cautious reasoning protected many people from unnecessary fear. But it also meant time passed before the full picture emerged. From my experience, I know how hard it is to respond quickly when symptoms overlap with everyday conditions, especially in older adults. Seniors often live with chronic fatigue, sleep changes, or breathing concerns. When something new appears, it blends into what is already there. Caregivers and clinicians alike may choose watchful waiting, which is often appropriate. The challenge comes when quiet signals continue to add up. Another reason responses were delayed is communication. In earlier outbreaks, messages were not always shared clearly or consistently. Communities received partial information, which led to confusion rather than action. When people do not understand what they are being asked to do or why it matters, they hesitate. That hesitation is human. It is not neglect. It is a natural response to uncertainty. What history teaches us is not that people failed, but that clarity matters. When communication improved and patterns were recognized, responses became calmer and more effective. Care shifted from reacting to single symptoms to observing changes over time. This approach is especially important for seniors, whose bodies may signal stress softly. Understanding how Nipah virus outbreaks began helps us appreciate the value of patience and careful listening. It reminds us that early confusion is common, and that delayed responses often reflect complexity rather than indifference. When we hold this knowledge gently, it strengthens trust in the process of care and reassures us that learning from the past supports steadier decisions today. Early warning signs that were missed. When we look back at past Nipah virus outbreaks, one of the most important lessons is how quietly early warning signs appeared. Illness did not announce itself in dramatic ways. It arrived as small changes that felt familiar, especially to older adults who already live with shifting energy, sleep patterns, and physical comfort. Many early symptoms were gentle enough to be explained away. A low-grade fever that did not last long, fatigue that felt like a busy week or poor sleep, a headache that came and went, slight dizziness or nausea that resolved on its own. In seniors, these sensations often blend into daily life. They are not ignored out of carelessness, but understood as part of aging or existing conditions. Delayed recognition often followed because these signs did not stand alone. They appeared one at a time and often improved briefly before returning. Without a clear pattern, neither families nor clinicians had reason to suspect something unusual. Doctors are trained to rule out common causes first, and that approach is usually protective. The challenge in outbreaks is that rare illnesses often look ordinary at the beginning. For older adults, subtle symptoms can be even harder to recognize because the body communicates differently. Fever may be muted, pain may be less sharp. Appetite changes may already be present. When the immune response is slower, signals arrive softly rather than urgently. This can delay the moment when someone seeks care or when testing is considered. In my years of caregiving, I have seen how early changes often show up in function rather than complaints. Someone moves more slowly. A routine feels harder to keep. Medications are missed. Sleep becomes fragmented. Mood shifts quietly. These changes can be mistaken for normal aging or stress, but they are often the body asking for attention. During past outbreaks, these functional signals were sometimes missed because the focus remained on obvious physical symptoms. Caregivers play a crucial role here. They notice when something is different from usual, even if it is hard to describe. A loved one who rests more than usual, less interest in conversation, a subtle confusion that was not present before. These observations matter deeply. They help clinicians see the full picture over time. History shows us that early warning signs were missed not because people failed, but because illness spoke softly and life continued. When recognition was delayed, it was often due to overlap with familiar conditions and the absence of clear guidance early on. This understanding helps us respond with compassion rather than blame. What we learn from these missed signs is the value of gentle observation. Not fear, but attention. Not urgency, but pattern recognition. When we respect how aging bodies communicate, we become better listeners. That listening supports earlier care, protects dignity, and helps seniors feel seen rather than overlooked. Communication gaps. During past epidemics. When I reflect on past epidemics, one of the most powerful lessons is how much communication shapes emotional safety. Illness does not create fear on its own. Confusion does. In earlier outbreaks, messages often arrived late, changed quickly, or sounded different depending on where people turned for information. That uncertainty unsettled families, especially older adults who value clarity and routine. Unclear messaging increased fear because people did not know what applied to them and what did not. Headlines spoke loudly, while details were scarce. Advice shifted without explanation. Some messages focused on worst outcomes without offering context. Others minimized concerns without guidance. When information feels inconsistent, the mind fills in the gaps, and imagination can become more distressing than reality. For seniors, this was especially difficult. Many lived through earlier public health crises and carried those memories forward. When messages were unclear, those memories resurfaced. Sleep suffered. Anxiety increased. Daily routines were disrupted. I saw patients who felt physically stable but emotionally overwhelmed simply because they could not make sense of what they were hearing. Communication gaps also affected care. Families hesitated to seek help because they were unsure what symptoms mattered. Caregivers worried about overreacting or being dismissed. Clinicians faced challenges as well. Without consistent guidance, it was harder to reassure patients while still encouraging thoughtful observation. The absence of clear language made it difficult to protect emotional balance on all sides. Another challenge was the pace of information. Messages often moved faster than understanding. Updates were frequent, but not always explained. For older adults and those living with memory changes, this rapid flow was exhausting. Too much information can be just as harmful as too little. The nervous system needs time to absorb and integrate. When that time is not given, fear can rise even in the absence of immediate danger. What history teaches us is the value of steady, compassionate communication. When messages were clear, calm, and consistent, People responded more thoughtfully. They asked better questions. They maintained routines. They felt safer making decisions together with their care teams. Clear communication did not eliminate uncertainty, but it reduced confusion and preserved dignity. In my practice, I learned to slow conversations down during uncertain times, to repeat key points gently, to explain what was known, what was still being learned, and what people could do now without urgency. This approach made a difference. It helped patients feel respected and supported rather than alarmed. Understanding communication gaps from the past reminds us why how we speak matters as much as what we say. When information is shared with care, it steadies the heart and protects emotional health. That steadiness allows older adults to remain engaged, informed, and calm, even when answers are still unfolding. The role of aging bodies in outbreak outcomes. When we talk about how outbreaks affect people differently, it is important to speak with respect for the aging body. Aging does not weaken the body's purpose. It changes how the body communicates, adapts, and protects itself. Understanding this helps explain why outcomes can look different for older adults without suggesting fragility or failure. As we age, the immune system becomes more measured. In younger bodies, immune responses tend to be fast and intense. Fever rises quickly. Inflammation signals are strong. In older adults, the response is often quieter and slower. Fever may be mild or absent. Inflammation may build gradually. The body is still responding, but it does so with restraint shaped by years of experience. This quieter response can sometimes delay recognition of illness, especially during outbreaks when early symptoms resemble everyday discomforts. Aging bodies are also managing more complexity. Many seniors live with chronic conditions that already draw on immune energy. Heart disease, diabetes, lung conditions, and memory changes require ongoing balance. When an infection enters the picture, the body must divide its attention. Energy that usually supports movement, digestion, or clear thinking is redirected toward healing. This redistribution can make fatigue deeper and recovery slower, not because the body is failing, but because it is prioritizing wisely. During past outbreaks, this complexity influenced outcomes. Older adults often did not present with dramatic early symptoms. Instead, changes appeared in function: less appetite, more sleep, subtle confusion. These signs were sometimes overlooked because they fit familiar patterns of aging. When care teams recognized that aging bodies signal stress differently, outcomes improved. Attention shifted from searching for dramatic signs to observing daily changes over time. Recovery also follows a different rhythm later in life. Younger bodies often rebound quickly after acute illness. Older bodies recover more steadily. Rest becomes essential. Routines matter. Sleep, hydration, and nutrition play a larger role in healing. When outbreaks disrupted daily patterns, recovery became more challenging. When routines were protected, resilience was supported. I have seen many older adults recover well when their bodies were given patience rather than pressure. When caregivers understood that slower recovery was not a setback, but a natural pace, anxiety eased. When clinicians adjusted expectations and focused on steady progress, trust grew. These small shifts in perspective made a meaningful difference. Aging bodies carry wisdom. They know how to conserve energy and avoid unnecessary strain. During outbreaks, honoring that wisdom supports better outcomes. It allows care to be tailored with dignity and respect. Understanding the role of aging in outbreak outcomes helps replace judgment with compassion and fear with clarity. It reminds us that strength does not disappear with age. It simply expresses itself differently, asking for patience, understanding, and gentle support. The role of aging bodies in outbreak outcomes. When we talk about how outbreaks affect people differently, it is important to speak with respect for the aging body. Aging does not weaken the body's purpose. It changes how the body communicates, adapts, and protects itself. Understanding this helps explain why outcomes can look different for older adults without suggesting fragility or failure. As we age, the immune system becomes more measured. In younger bodies, immune responses tend to be fast and intense. Fever rises quickly. Inflammation signals are strong. In older adults, the response is often quieter and slower. Fever may be mild or absent. Inflammation may build gradually. The body is still responding, but it does so with restraint shaped by years of experience. This quieter response can sometimes delay recognition of illness, especially during outbreaks when early symptoms resemble everyday discomforts. Aging bodies are also managing more complexity. Many seniors live with chronic conditions that already draw on immune energy. Heart disease, diabetes, lung conditions, and memory changes require ongoing balance. When an infection enters the picture, the body must divide its attention. Energy that usually supports movement, digestion, or clear thinking is redirected toward healing. This redistribution can make fatigue deeper and recovery slower, not because the body is failing, but because it is prioritizing wisely. During past outbreaks, this complexity influenced outcomes. Older adults often did not present with dramatic early symptoms. Instead, changes appeared in function: less appetite, more sleep, subtle confusion. These signs were sometimes overlooked because they fit familiar patterns of aging. When care teams recognized that aging bodies signal stress differently, outcomes improved. Attention shifted from searching for dramatic signs to observing daily changes over time. Recovery also follows a different rhythm later in life. Younger bodies often rebound quickly after acute illness. Older bodies recover more steadily. Rest becomes essential. Routines matter. Sleep, hydration, and nutrition play a larger role in healing. When outbreaks disrupted daily patterns, recovery became more challenging. When routines were protected, resilience was supported. I have seen many older adults recover well when their bodies were given patience rather than pressure. When caregivers understood that slower recovery was not a setback, but a natural pace, anxiety eased. When clinicians adjusted expectations and focused on steady progress, trust grew. These small shifts in perspective made a meaningful difference. Aging bodies carry wisdom. They know how to conserve energy and avoid unnecessary strain. During outbreaks, honoring that wisdom supports better outcomes. It allows care to be tailored with dignity and respect. Understanding the role of aging in outbreak outcomes helps replace judgment with compassion and fear with clarity. It reminds us that strength does not disappear with age. It simply expresses itself differently, asking for patience, understanding, and gentle support. Why seniors are affected differently. As we age, the body becomes deeply connected to routine. Daily rhythms guide everything from sleep and appetite to balance and emotional steadiness. When an outbreak disrupts those rhythms, the effect can feel stronger for seniors, not because they are fragile, but because their bodies rely on consistency to stay well. Even small interruptions can ripple through multiple systems at once. Many older adults live with more than one health condition. These conditions are not failures. They are the result of a long life lived fully. Heart disease, diabetes, lung conditions, arthritis, and memory changes often exist together. When illness enters the picture, the body must divide its attention. Energy that once supported movement, digestion, or clear thinking is redirected toward healing. With several conditions already drawing on that energy, recovery can take longer and require more rest. Routine disruption plays a quiet but powerful role. During past outbreaks, seniors often experienced changes in sleep schedules, mealtimes, and activity levels. Familiar appointments were postponed. Social contact decreased. For someone living with memory loss, these changes could feel disorienting. Confusion increased not because the illness worsened, but because the environment became unfamiliar. Emotional safety depends heavily on predictability, and when predictability fades, the nervous system feels unsettled. Recovery challenges also look different later in life. Younger bodies often bounce back quickly once symptoms improve. Older bodies recover more gradually. Muscles lose strength faster with rest. Balance can be affected by even brief illness. appetite may take time to return. None of this signals decline. It signals the body asking for patience and gentle support. I have seen many seniors regain strength when recovery was approached thoughtfully. Hydration was prioritized, nutrition was simplified and nourishing. Sleep was protected rather than rushed. Familiar routines were reintroduced slowly. Caregivers and clinicians worked together, observing progress over days rather than hours. This steady approach reduced complications and restored confidence. Emotional response matters just as much as physical recovery. Worry can drain energy needed for healing. Calm reassurance helps the body conserve strength. When seniors feel understood rather than pressured, they are more likely to rest, eat, and engage with care. Understanding why seniors are affected differently allows us to respond with kindness instead of urgency. It reminds us that slower recovery is not a setback. It is a natural rhythm shaped by experience and wisdom. When we honor that rhythm, we protect dignity and support healing in a way that respects the life already being lived. How doctors apply these lessons today. When I look at how doctors care for patients today, I see the quiet influence of outbreak history in nearly every thoughtful decision. Past epidemics taught us that speed without clarity creates anxiety, while preparedness with calm communication builds trust. Modern care is shaped by those lessons, especially when supporting older adults who benefit most from steadiness and respect. Preparedness now begins long before anyone feels unwell. Clinics and hospitals plan for clear pathways of care, so confusion does not take over when questions arise. Teams practice how to share information in plain language, how to listen to caregivers, and how to protect routines whenever possible. These preparations are not dramatic, they are practical. They reduce noise and help people feel oriented during uncertain moments. Doctors also apply history by watching patterns over time, rather than reacting to one symptom. We learned that early signs can be subtle and that rushing to conclusions can do harm. Today, clinicians focus on baselines, function, and change. We ask how sleep, appetite, movement, and thinking compare to a person's usual day. This approach respects the complexity of aging bodies and avoids unnecessary alarm. Communication has changed as well. Past outbreaks showed us that unclear messages increase fear. Now, many clinicians take time to explain what is known, what is still being learned, and what steps are reasonable right now. We repeat important points gently and invite questions. This protects emotional safety and helps patients and families make decisions with confidence rather than urgency. History also reshaped how caregivers are included. Doctors learned that caregivers often notice changes before anyone else, especially for those living with memory loss. Today, their observations are valued as clinical information. This partnership improves care and helps seniors feel supported rather than scrutinized. Calm response is another lasting lesson. Outbreak history taught us that anxiety can worsen outcomes by disrupting sleep, appetite, and balance. Modern preparedness includes protecting the nervous system. We encourage familiar routines, limit overwhelming information, and support rest. These steps are as important as medical treatments. I have seen how these lessons change experiences for seniors. Appointments feel less rushed, conversations feel clearer, decisions feel shared. When care is grounded in history and delivered with patience, people feel steadier even when answers take time. Applying lessons from the past does not mean living in it. It means using wisdom earned through experience to care better today. This approach honors dignity and keeps fear from guiding decisions. It allows older adults to feel informed, prepared, and calm, knowing that modern care is shaped by understanding rather than haste. Emotional safety. During public health events. Emotional safety is not separate from physical health. It is woven into how the body responds to stress, recovers from illness, and maintains balance. During public health events, protecting the nervous system becomes just as important as monitoring symptoms. I have seen many times how fear, even when well-intentioned, can quietly undermine well-being. When the nervous system senses constant threat, it stays on alert. Sleep becomes lighter. Muscles tense. Breathing shortens. Memory and attention suffer. For older adults, this state of vigilance can increase the risk of falls, worsen blood pressure control, and deepen confusion. For those living with dementia, anxiety can amplify agitation or withdrawal. None of this is a personal failure. It is a biological response to feeling unsafe. Avoiding panic-driven decisions begins with slowing the flow of information. During past public health events, people were exposed to frequent updates without context. This overwhelmed the nervous system. Today, one of the most protective steps is choosing a limited number of reliable sources and checking them at predictable times. Routine calms the brain. Predictability restores a sense of control. Another important practice is grounding decisions in observation rather than urgency. When something changes, it helps to ask what is different from usual and how long it has been present. This simple pause creates space for clarity. It allows the body to settle and the mind to think. Decisions made from this steadier place tend to be kinder and more accurate. Caregivers play a vital role in emotional safety. When caregivers speak calmly and move slowly, the people they support often mirror that steadiness. Gentle reassurance, familiar surroundings, and consistent routines help the nervous system feel safe. This safety supports sleep, appetite, and cooperation with care, which are essential for recovery. I often remind patients that emotional safety does not mean ignoring concerns. It means addressing them in a way the body can tolerate. Naming worries, sharing them with a trusted clinician or family member, and creating a simple plan all help reduce fear. A plan does not need to be complex. It only needs to offer a next step. Public health events test patience, but patience is a form of protection. When we honor the nervous system's need for calm, we support the immune system and the brain. We reduce unnecessary strain and preserve dignity. Emotional safety allows seniors to remain engaged with life rather than consumed by worry. It keeps decision-making thoughtful and humane. By choosing calm over haste, we protect not only health, but also the peace that makes health possible. Turning history into wisdom. When we step back and look at outbreak history with gentle eyes, something important becomes clear. History is not asking us to stay alert every moment or to live in a state of watchfulness. It is inviting us to grow wiser. Wisdom is different from vigilance. Vigilance tightens the body and narrows attention. Wisdom softens the body and widens understanding. Outbreaks from the past show us how easily fear can take hold when information feels overwhelming or unclear. They also show us something steadier. When people paused, listened carefully, and responded with patience, outcomes improved. Communities that learned to observe patterns rather than react to headlines were better able to protect both physical and emotional health. This is the guidance history offers. Living with awareness means knowing yourself well. It means understanding what feels normal for your body and noticing when something truly changes. It does not mean scanning every sensation for danger. For seniors, awareness grows from routine. Regular sleep, nourishing meals, gentle movement, and familiar rhythms help the body communicate clearly. When routines are strong, changes stand out without effort. Wisdom also means trusting time. Many health concerns reveal themselves gradually. Rushing to conclusions can create distress without adding clarity. Allowing time for observation respects the body's pace, especially in later life. It gives space for calm conversations with caregivers and clinicians. It keeps decisions grounded rather than reactive. For those living with memory changes, turning history into wisdom is especially meaningful. Constant vigilance can overwhelm the brain and increase confusion. Calm awareness creates safety. When caregivers respond to changes with patience and reassurance, the nervous system settles. This steadiness protects dignity and preserves connection, even during uncertain moments. I have seen how people thrive when they stop carrying the weight of every warning and instead carry understanding. They stay informed without becoming consumed They listen without fear, they act thoughtfully when needed, and rest when rest is called for. This balance is not accidental. It is learned through experience and reflection. History does not ask us to relive past fears. It offers us guidance for living well today. Awareness rooted in wisdom allows seniors to move forward with confidence and grace. It honors the life already lived and the strength that comes with it. As we hold these lessons gently, we remember that health is not about constant vigilance. It is about thoughtful presence. Senior Health Daily exists to support that presence, a steady place you can return to when questions arise, offering clarity, reassurance, and connection. If it feels right, I invite you to stay connected and continue learning together, calmly and with care. As we come to the close of our time together, I want to slow the pace and invite a quiet moment of reflection. Looking back at history does not mean we are moving backward. It means we are learning. And when people learn, history does not repeat itself. It transforms into wisdom that guides gentler choices and steadier lives. Over the years, your body has carried you through uncertainty, change, and recovery more times than you may remember. It has adjusted, protected, and endured with a quiet strength that deserves gratitude. Aging brings not only challenges, but also a deep well of experience. That experience teaches discernment. It teaches when to act and when to wait. It teaches how to listen without fear. Awareness is not something that takes peace away. Awareness is dignity. It allows you to notice without panic and to respond without rushing. Patience becomes a form of protection, giving the body time to speak clearly and the mind time to understand. Calm understanding is strength. It steadies the nervous system and creates space for thoughtful decisions that honor both health and quality of life. Health is never a solitary effort. It is a partnership that unfolds between the body and the mind, between caregivers and community, and between today and the time it takes for clarity to emerge. When that partnership is built on trust rather than urgency, it feels lighter. You are no longer carrying the weight alone. If there is one feeling I hope stays with you after this video, it is reassurance. You do not need to live in vigilance to be prepared. You do not need to fear history to learn from it. You are already doing something meaningful by listening, reflecting, and caring for yourself with intention. Senior Health Daily exists as a steady place you can return to when questions arise. Not for alarms or pressure, but for clarity, reassurance, and connection. If it feels right, I invite you to stay connected with us. We will continue walking this path together, with patience, respect, and confidence in the strength that comes from living with awareness and grace.